Good afternoon, everybody, and welcome to our joint webinar with the CoMaCH UK South Africa network. Today we are very excited to have a webinar entitled Not Necessarily Mobile, Digital, Radio and Other ICT Approaches to Community Outreach. The three speakers are myself. I'm from the Centre of Excellence in Human Development. There's Astrid Treffry-Goatley and Maria Rosa Lorini. But I'm going to hand over to Melissa or Nervo just to introduce CoMaCH and the purpose of this project and this network and the webinars. And yes, and then introductions away, but welcome everybody.
Great, thank you, Beth. Welcome to the fifth webinar in this series. The CoMaCH network seeks to empower community voices in the design of digital maternal and child health interventions. We're an interdisciplinary network of researchers from computer science, social sciences, health, and medical sciences based in South Africa, the UK, and beyond. And this month, starting this month, we're excited to partner with the Center of Excellence in Human Development to host the webinar series, and as well as our collaborations and research. Today, we've invited Maria Rosa Lorini, who's a postdoctoral researcher at the Royal Holloway, University of London, Astrid Treffry-Goatley from the Center for Visual Methodologies for Social Change at the University of KwaZulu-Natal, and Beth Amato, who is the Communications Officer at the Center of Excellence in Human Development, hosted at Wits University in South Africa. And they will help us explore less mobile approaches or not mobile approaches to connecting people from radio and digital storytelling to music and science and beyond. Maria Rosa is going to start us off. And so while she's sharing her screen, I would like to introduce her. Maria Rosa Lorini is a postdoctoral researcher at the Royal Holloway, University of London. She's currently working in the GCRF-funded Migration for Development and Equality project that aims to reduce inequalities and contribute to development. Maria Rosa is primarily working on digital technologies and migration. And before that, she was a postdoctoral researcher at ICT, working on co-design projects with underserved communities in South Africa, including collaborating with me on one of our projects. So I'm excited to hear from her today and to share what she's learned with you.
I hope you can see. Is it working?
Yes, go ahead.
Awesome. Good afternoon. Yeah, my name is Maria Rosa Lorini. Yes, I'm a postdoctoral researcher at Royal Holloway, University of London, and I moved here only last month. But I spent the previous 12 years in South Africa, mainly in Cape Town, working in underserved communities, both as a practitioner, collaborating with NGOs and non-governmental organizations and community-based organizations, and as a researcher for my PhD and as postdoc at UCT. What I will present is part of our research project, which developed over 4 years as a community-based participatory study in the urban periphery of Cape Town, mainly between Khayelitsha and Philippi. And the research is framed within the field of information and communication technology for development, which you probably are all well prepared and aware. ICT4D has given credit for its great potential to address global development priorities, such as access to information and infrastructures, as is a radio, welfare services and business industries, and a lot of other possibilities like what we are studying mainly for maternal health and child health. Despite the aim of being to improve the life and the condition of underserved people, ICT4D literature also indicates some worrisome problems connected to digital and social exclusion. Grassroots beneficiaries are frequently not involved in the development processes, whether it's a conceptualization or implementation of the project. And sometimes the problem are even worse because projects may be based on a market profit base. I cannot turn my slides. Uh-oh. Oh, here we are. Sorry. The action research that I've done followed an abductive approach with several phases. As you can see, as exploratory and ethnographic phase, a co-design phase, and the theoretical phase that intertwine each other during the process. And I like to present today's project on the radio, community radio, in the same way, a bit of ethnographic background, the co-design activities that I've run with the communities, and some reflection, lessons learned along the way. An emergent approach was used where processes unfolded without a prearranged path. This method supported the possibility of co-designing projects and allowed the participants to decide on their roles and intentions. Much preparation was needed for the training to determine the best way to introduce digital novelty in the community and establish ways to interacting amongst culturally diverse participants. Instead of presenting the community I work with and reporting some voices from the field, I would like to share a video that I hope is starting. And let some of the community members introduce themselves, their community, and the activities we have run together. CoE FM is the name of the community radio station.
Oh yes, this is Samora Mashal. This is our community. We are from here, me, Z, and other guys that we started CoE FM 97.0. It's where we live in, and we started. Oh, I love my community. We are inside now to the newsroom, and the guys, they are busy preparing the news. And as you can see that we are busy. By the way, before we checked everything, as you can see that now we're using CoE's laptop, which is we kind of like with the equipment so that these guys, they can enroll, they can do great work, because we need computers, as you can see, and we need a lot of equipment though. But I would love them to say something, you know, because it would be lovely if they can say something. Hi guys. How are you doing? How's it?
It has radio shows that involve our cultures. It teaches us about our cultures, mostly here because we are living in the urban areas, we tend to forget about our cultures. So I like, the most thing I like about it is that it brings back our culture, and it also encourages our traditions, so that we must stick to our traditions and stick to our language as well, because we tend to forget that when we're here in the Western Cape area.
Hey guys, I'm Samara. I'm listening to CoE FM community radio station. You see, I'm outside, but I'm listening to the radio. What I like about this radio, it teaches us young, intelligent people to listen, and it teaches us more about how to volunteer. You know, as people tend to forget about volunteering, we always do something in the party. Here at the station, it teaches us to give back to community. It teaches us to improve our community, and it gives us the energy. And as community leaders, if we can listen as all South Africans, we can see the challenges that we face in communities. We can see the problems that as young people we face, and the government can be able to overcome those kind of challenges, because it will come to community members. Because community education, it gives people the chance to express their opinions, the chance to speak out their challenges and to face those challenges. Thank you.
Okay, my name is Khululeka Farm. I'm doing the lunchtime show Monday to Fridays about CoE FM 97.0, your number one community radio station around the Western Cape, the best community radio station. Stay tuned, 97.0. The way it is, man.
I prepared a few more slices in case the video will have not worked, but it was working. So it was about the place where I work, the people I work, and the fact that there are so many opportunities, and maybe what we are less familiar with in the community is the fact that there are a lot of network of people that are really trying to make a difference in their community. And to initiate a community activity, I started with mapping the activity that the groups were already doing in their community in order to know what exists and what can be done together. And amongst the group, the youth groups I work with, one emerged for his decision to create this community radio station, who started to broadcast as a pirate station in 2016. And the participant created the video that you have seen to fundraise for their radio because they needed more material and possibility. And their digital storytelling illustrates the process from the moment when the idea was conceptualized to when they started broadcasting. I guess what can be interesting is to see what happened after the creation of the digital storytelling and the fundraising they have done. So these were voices from the field in case the video wasn't working. So after they created the radio, they started broadcasting. They also realized that they have some limits, and some skills and knowledges could have been developed further to improve their possibility to reach out for more people. So we had a series of co-design workshops where we were trying to map one side the activities already going on, the resources in the community, the possibility to do more, and eventually we co-designed a website, and we have had different solutions designed physically, designed by the people, the groups, about what they would have liked to see in a potentially a new website and an online radio station that could broadcast live what they were doing. And the activities resulted in increasing their potential to use technology to reach out for more people. The community journalists started using an application on their smartphone to broadcast directly from the community, and not only from physically the radio station that is in the community center of Samora Machel. The project continued, and the founders decided to request a broadcasting license from the government, and they obtained it in 2018. Analog radio remains the main means you use to listen to news because it doesn't require data, obviously. But we created as well the website in order to have other opportunities to connect with other radio stations and reach out for people that are not in the array of action of the radio station, the analog one. And also gives a possibility for the different actors, the different founders and activists of the radio to learn new skills. And to have an inclusive approach to new possibility. We saw a lot of changes along the years, obviously, because new technology arrived and got mixed. So between the analog radio station, the digital radio station, and nowadays with the social media. The changes that we saw and experimented in the years, mixing analog and radio and social media, are even more visible now. During the pandemic, hybrid solutions have been adopted by several organizations, researcher activists to reach out for people in need, knowing that nowadays, majority of people have smartphones or have access to some packages, inclusive of social media, for their data. Does it mean that we have to go digital and abandon the analog radio, or does it mean we have to go for a specific solutions only? Well, for what is my little lessons learned that I would like to share, I think that the most important thing is the process that we follow and we go through in our relationship with the community we work with, and in the reflective process that we have over the intention of what we want to do, and what are also the consideration of the risk that can be implicit or explicit in utilizing technologies. Most of the ICT for the project do not succeed to reach out to the anticipated outcomes due to the limited knowledge of the context, since they are not grounded in the local realities, and because the local communities do not participate consistently and constantly. Failing examples in ICT for the literature are, for instance, the White Elephants project, which deployed technology soon abandoned, and Bangi project, where researchers stay for a really short time. So positive and negative impacts can exist in ICT, but methods and how we approach, how we work can make the difference for any project. Processes of empowerment can allow participants to lead the change, to create further opportunities, to strengthen local mechanisms that already exist in the community, create ownership for the project and sustainability, resulting in further empowerment, development, and maybe emancipation. Few references, and looking forward for the discussion about which technology do you trust, what is accessible to you, and what is representative for you. Thank you.
Great, thank you so much, Maria Rosa. We will open for questions after all three speakers have spoken, but if you have burning questions in the meantime, or if you just want to write it down, feel free to pop your questions in the chat. I just want to remind everybody that the seminar is being recorded and we'll post it to YouTube after the webinar. And now, while Astrid is sharing her screen, I'm not sure if you actually need to, but I'm going to introduce her. So Astrid Treffry-Goatley is the senior researcher at the Center for Visual Methodologies for Social Change at the University of KwaZulu-Natal. Her research interests include gender equality, girlhood studies, participatory visual research, and ethnomusicology. Please go ahead.
Thank you. I'm just sharing the screen. A second. Can you see it?
Yep.
Okay, good. Okay, so thank you for the introduction, Melissa. So I work at the Centre for Visual Methodologies for Social Change, and today I'm going to tell you about an exciting project called Jiving with Science. How do I change? Enter. Just trying to see how you move forward the slides.
Try arrows.
Not moving. Okay, it's working. Okay, so the goal of our project is to harness music and dialogue to make science more fun and accessible to the general public and to foster engagement with health research. So we had two phases. The original Jiving with Science project focused on HIV, and it started in 2020, and we've recently reinvigorated it with a focus on COVID-19. I don't know why I say the right arrows or not. Can I give you, Melissa, can I ask you to move it? It's not. Oh, it is. I don't know why okay, so I don't know why it's not always moving. So in the original project, we were based in Matuba, which is a rural area in KwaZulu-Natal. And there's at that time in particular, there was a very high rate of HIV and TB infection. And it was challenged by a low treatment uptake and low testing uptake. So there was a need to encourage people to go to local facilities for testing. And the original project was funded by the Wellcome Trust, and our aims were to foster community discussion about local scientific results, to bring evidence-based messages to everyday spaces, and to engender behaviour change to encourage testing and treatment. And so we did this by designing 4 edutainment CDs, and we partnered with the music industry to get songs for free to put on the CDs, and each CD had a narrative with songs in between, and we distributed them freely to taxi drivers, to hair salons, and also to traditional leaders. And our main target audience were taxi drivers and their commuters. So we did a small-scale quantitative evaluation of the project, and overall we got a very good response to the product from drivers and their commuters. People liked the music we'd selected, and they liked the narrative. And the evidence that we saw showed that having the CDs played in taxis encouraged dialogue about HIV and about health research in taxis. But one of the things that we really struggled with was distribution, because we partnered with the local taxi association to distribute the products, but we found that only half of the drivers reported having received the CDs, and many said that they'd broken and that they'd lost them, or they got scratched on the very bumpy dirt roads. So the durability of the product wasn't so great. So in future, we would think that it would be good to go digital. At that time, there weren't many smartphones around, but to maybe create a product for smartphones or to partner with a local radio station. So there were some of our preliminary findings, and we share more of them in our publications, which I've listed there. So in 2020, with the advent of COVID, we started thinking about fun ways again to make science more part of everyday life, and to challenge the diffusion of misinformation and disinformation, and also to challenge the anxiety and hesitancy people feel towards vaccines and mask wearing. So it was a partnership. This has been a partnership project between CRISP, I don't know if anyone knows about CRISP, it's UKZN, and the Centre for Vision Methodologies. My husband actually runs CRISP, and I'm at the CVM, so it was something that we just discussed and came up together. So it hasn't got official funding. It's something that we're just working on together as a team. So our interest in this project has been to spark public interest and trust in science through the involvement of local musicians, and to involve local musicians a platform to profile their work and to ask scientists questions, and then to use musical interludes between the conversation to bring comfort, connection, and healing in this time of loss and uncertainty. So in terms of method, we created short videos and podcasts, and each episode revolves around a conversation between a scientist and a local musician about life in the time of COVID. So the idea is to normalize conversations around COVID. And the dialogue is punctuated by short musical interludes, which are played by the musician during the recording. And then we shared these, we created podcasts and videos, and then we've shared them on social media and YouTube. So at the moment, it's a pilot project. It's something, as I said, that's developing organically, and we've had three episodes so far. The first one features Guy Buttery, a local musician, and they have a conversation about variants and vaccines. In the second one, we interview Nibs van der Spey and talk about the third wave and vaccinations. And the last one, there's a conversation between Tulio de Oliveira, Neil Gonzalez, and Mandla Macha. And they're looking at vaccinations and how vaccination can increase the chances of returning to normality and going back to music concerts, and how this can have a positive impact on the musicians and the music industry. So we haven't done a formal evaluation yet, but so far the public response has been good. We've had over 1,000 views of the 3 videos in less than a month. And the project was also featured by the Sunday Times on 24th of May. So our question is how to make it more worthwhile for the artists, because so far we've been going quite tentatively, and so far I've only involved close friends who had expressed an interest in the project, and people that we knew who are not struggling financially, who have an existing revenue stream through their families or through teaching, music teaching. And we didn't want to take advantage of artists who've been struggling due to the restrictions. But despite this hesitancies, many artists have approached us and wanted to get involved in the project and would like to profile their work. And so we're going to carry on developing it. And in the next 6 to 12 months, we're planning to raise funding. We're going to target corporate funders so we can offer the participating musicians a stipend, something equivalent to what they'd receive as for a show or as a recording artist. And they've also asked us, the musicians who've been speaking to us have asked us to, in future, link further to their social media platforms, websites, and online booking information. And in the steps to, going forward, we're going to broaden the scope of the content by featuring a greater diversity of artistic genres, poets and visual artists, also musical genres, to also expand on the language. So far it's all in English, but it'd be nice to have Zulu and other local languages. And genders, getting more women involved, in particular, and ethnicities, and also to expand on the scientific disciplines, because South Africa also has a strong track record in astronomy and biodiversity, and it would be good to bring those also to the public sphere. And then, of course, a more participatory development process. My work, particularly these days, is more around participatory visual methodologies, and I'd like to bring that participatory process to the development of the films themselves. And lastly, to increase the reach and impact of the project, we'd like to get the films on television, and recently East Coast Radio has asked us if they can feature the podcasts and feature the project. So yeah, to find a more sustainable way of reaching out to people. Yeah, so I just want to, in closing, just to say that this is a team effort. It's not just my own work, I work in a team, and of course we'd like to thank our funders, the Wellcome Trust for the first version of Jiving with Science, and then in our newer work, I work with UKZN's flagship program and also the Technology Innovation Agency, so to thank their input in my work, and then the scientists, filmmakers and musicians who've been involved. So thank you for your time. I'm finished.
Great, thank you so much, Astrid. It's so interesting hearing about your work. There's already a few questions in the chat if you want to answer those in text, and we can also talk about those after Beth's talk. Let's see, I think if you can just turn off your share so that Beth can share her screens. Our last speaker is Beth Amato, who is a communications officer at the Center of Excellence in Human Development. She's trained as a writer and journalist and has a postgraduate degree in African literature. She's also an early childhood development reporting fellow at the Dart Center for Journalism and Trauma at Columbia Journalism School and at the Columbia Journalism School in New York City. Her work focuses on promotion of public engagement with all aspects of human development. And I'm excited to hear about the radio program that they've been running around maternal and child health, around social messaging. So thank you so much, Beth.
Okay, hi everybody. I hope that you can see my screen. If everyone can just give me a heads up that's on camera. Maria, can you see my screen? Okay, great. So welcome to my talk. We, the Center of Excellence in Human Development, runs various research projects across the human development and life course spectrum. One of our flagship research endeavors is around preconception health, which essentially looks at health for young women before they even consider becoming pregnant, because there's research that is shows why it's very important to be healthy as young as possible before one falls pregnant, just for greater health outcomes at a later stage. So it's called the Healthy Social Messaging Project. It's Healthy Life Trajectories Initiative, and there's various sites across the world, including in China, India, and Canada, that is looking at various aspects of preconception health. So what we did is we decided to put together some kind of raising awareness or awareness campaign around preconception health. And so we wanted to find out from focus group members, from young women, where they get their information from, who are the influencers, the social media influencers that they're interested in hearing about, what topics are of interest to them. So that we could plan something. It wasn't necessarily at that point a radio serial, but to plan a kind of awareness campaign. We did have some funding from the Medical Research Council, so we thought, well, let's just go out into the community and use and have a focus group of women just to ask what their preferences were. So we had 8 focus groups of 10 women thereabouts. And we had asked them, it was at Baragwanath Hospital. So that was where the location was, and this was in 2019, so before COVID, what kind of information, they were interested in, if they knew about preconception health, if that was of interest. And we came up with some, well, the outcome was very interesting, in that we saw that while health and wellness is, of course, important, there were other really pressing factors and pressing issues that the women were facing, including a lot of mental health related issues, depression, postpartum depression, bereavement, and often compounded by the facts of sort of high youth unemployment and lack of access to good education. Also just kind of supporting big families. So it was interesting just to see the context of what people were interested in and how we could then tailor a program around raising awareness about preconception health when there were so many other issues abounding, and how we could tie it all in, because we did find it interrelated anyway. So what we did is we created an 11-part radio serial, which I'll let you listen to a snippet of it in a bit. I'm trying to kind of go quickly so that we can listen more to the radio serial as opposed to my voice. But what we did is that we partnered with Ukhozi FM, which is the largest radio station in Africa. It is broadcast in isiZulu. Their studios are in KwaZulu-Natal. But obviously, we wanted to have it in Zulu so that it could be accessible to the whole country. And we named it Phila Impilo Yakho Kankpono, which is Live Your Best Life. That was our radio serial. And the topics that we looked at were that at least we came up in these focus groups of what would be important to discuss was postpartum depression, suicide, the issue of kind of like healthy eating and how does one go about healthy eating when it's not expensive? I mean, when it is expensive rather. So we looked at community food gardens to see what people were actually doing. We looked at high blood pressure, diabetes and sugar. We looked at gender-based violence, education, and employment. So those are just some of the topics that we touched on during these 11 serial episode. So I'm just going to play you one of them. So just bear with me as I find this thing now. This is episode 5 of Live Your Best Life. This is the English recording. So we did an isiZulu recording at Ukhozi Studios, and then I got the same actors to record it in English afterwards. So here is just a snippet. They are 15 minutes, they're 13 minutes each. So I won't obviously play the whole 13 minutes, but here's just a snippet of some of the radio series. Just let me know if you can hear it nicely.
Live Your Best Life. Phila impilo yakho kangcono. A radio program on health and wellness for young people. Brought to you by the CoE-Human Africa and the Center of Excellence in Human Development. This is episode 5. Live your best life. Phila impilo yakho kangcono. I hear you saying your mantra today, my child. Phila impilo yakho kangcono. But you don't look like you're happy. You look worried. What's wrong?
Ma, it's Patricia. Ever since she had her baby, she's been very sad.
She worries that she's not taking care of the baby well. Oh, that's bad. Does she have support? Yes, she does, but she feels as though everyone is more interested in the baby than her. She seems to need more care than she's getting. Is she staying with her mom? Yes, her mom is helping her with the baby. Is she breastfeeding? Yes, she is. That seems to be the only time she holds her baby. She was so happy about being pregnant, you know? Now I just don't know. She just doesn't want to be with him. And her mother's very worried. I think we must go see her. Hello, Patricia. How are you? Meet the baby. Oh my, look at him. What's his name? Stembiso. We call him Stay. Oh, beautiful little Stay. Oh, you're so cute. Come to Auntie. Oh, and you're so active. Oh, I love the smell of babies. Oh, don't get any ideas, Wayna. All right, let me leave you guys to gossip alone. Let me go and greet your mother in the kitchen. I brought sugar-free biscuits for you too, Patricia. Way to go, Ma. Sugar-free. Oh, yes. New diet, of course. Let me catch up with your mother. Yes, Ma's in the kitchen. And thank you for the biscuits. I'll try and eat them later. I don't feel like eating at the moment. Nothing tastes good for me. My friend, I'm so worried about you. You sounded unhappy in the WhatsApp message you sent me. To be honest, I feel very down, Chomza. And my mother thinks I'm just being difficult. I don't know what to do. I'm so sorry, but is something bothering you? Chomza, everything. I just don't want to hold the baby. I don't feel like eating. I cry all the time. I just feel like I'm on my own on this. No, I'm so sorry, my friend. And Temba is not even interested in the baby. I'm sorry. So, Chomza, what can I say? Everything is just wrong. If it was not for that baby shower that you threw me, I would not feel like anyone cares about me. You're a very good friend. Well, that's what friends are for. Tell me, did you get depressed when you had Amanda? Depressed? I was 16. I didn't know what was going on. I didn't know anything. And is Amanda helping you? Yes, she is. I wouldn't know what to do without that sweet little girl. I'm sorry about Temba. Maybe one day he'll realize that being a father is a great thing. Do you think I should ask Mdendo to talk to him? I mean, they are friends. Yes, please. Can you do that? You know, being depressed after giving birth can easily happen. Seriously? Yeah. When you told me on Wednesday that you're feeling depressed, I actually Googled it. Zotra, the researcher. Because fake news is no news at all. I'm so glad that I could make you laugh. Yeah, you did. You know, I found out that 1 in every 3 women in South Africa gets depressed after giving birth. Oh. It's called postnatal depression. I think that's what you have, Patricia. Yeah, I know about postnatal depression, but what is it exactly? Okay, so after I spoke to you, I did some research. And this is what I found. After giving birth, lots of women feel a little down or emotional. That can happen. But if this lasts for more than a couple of weeks, it could be postpartum or postnatal depression. This can start up at any time of the year after giving birth. It doesn't have to be like straight away. But Chomza, how do you know if you have it? It can be difficult to recognize, as it can cause so many different things that women may think are natural after giving birth, like feeling low or sleeping or losing or gaining weight or a lack of energy or problems making decisions or even concentrating. Oh my God, that is so me. I can't concentrate on anything and I'm worried all the time. The thing that makes me concerned is that I'm crying and you know I never cry. I'm sorry, Choman. It also says that it can be hard to bond with the baby, and sometimes women may want to hurt the baby or even themselves. I don't want to hurt the baby, but I'm just not interested in him at all. I thought I was a bad person, not a good mother. Now at least I know what is happening to me. Okay, I'm sorry for cutting that short.
There are, it's all available on SoundCloud, and I have given at the end of this presentation, I'll be able to just share with you where we can find all 11 episodes. Bear in mind that this is the English version. I haven't flighted this anywhere yet. So this was all in isiZulu. So that just gave you an idea of what the characters started talking about, just about overall health. So what we did just to create more awareness, or to create more engagement and perhaps provide more resources, what we realized is that when we spoke to the women in the focus group, they said that they did they did go to Facebook to get further information. It was more so than on Twitter or Instagram. And obviously we wanted to do something via WhatsApp. We just didn't have the funds for that. So what we did is that we got a cartoonist just to kind of do, as you can see here, it's some of the dialogue that we kind of extracted and then put it into a cartoon. So here's Sis Patricia and Zodwa talking. Our Facebook page is here, so if you can see health and wellness website, there it is over there. Okay, then so each week I would say, remember to tune into Ukhozi 91.5. And if you are suffering from postpartum depression, you can call SADAC, and there was other resources that we managed to put forward. And this wasn't only about postpartum depression, there was others about measuring. There was a measurement month opportunity for people to go and measure their blood pressure and their sugar levels. So it was quite diverse. I did find, though, that this is the kind of feedback that I got back, especially after particular episodes. So I think, for instance, we when it was the gender-based violence episode and the suicide episode and the mental health episode, the engagement increased on the Facebook messaging. So this is just some of the, obviously the Linda Lani's one is positive, but you can see someone has said, how I don't have a job, so how can I live a best life? And then, someone wants to know if we talk about depression and how can I get my life back to normal after having a baby? I lost confidence and my self-esteem is very low. So it's this kind of thing that we got feedback from, and just to add, which I didn't add earlier, we did boost the posts that I posted. So say if I had something around, so if I had something around, if there was an episode every week, I would put Facebook advertising and flight that across South Africa so that people would be aware of the radio serial. The insights so far, sorry, this is very kind of poor, but there we go. So the paid reach is, we got 108,000 people, the trends, and one of the highest engaged posts was around gender-based violence. So there was 409 engagements. It was quite interesting. And then this is just an audience trend. So you can see that most of the people are from Soweto because that's where I had targeted it. And then now with the English serial, we're not sure what to do. Perhaps I'm thinking of ideas across Africa and with international health partners. But at the moment, the series is being flighted over Jozi FM, which is a very specifically, it's a Soweto-based radio station. So that's where we are at the moment. So thank you for listening. I'm sure there's some questions and I can guide you on all of that. Thanks.
Thank you, Beth. Is there any questions in the audience? Somebody wants to ask something, or we can just go through the different questions in the chat. Is there anybody? who wants to raise a question? Or I saw Maria Rosa was trying to reply already some of the questions in the chat, so maybe you can elaborate a little bit more on your replies. Maria Rosa. I think it was also a question for Astrid about this, how it was similarly, both projects were really into the cultural, right? The cultural aspects. And I remember from the video from Maria Rosa, there was also this person who was talking about the traditions and language, right? So if you can just elaborate more while looking if more people are asking questions.
Sure. I think what I was trying to say is, I think the pandemic, the last year, highlighted quite a lot, show how much we don't know about certain realities in the bad and the good situation. I mean, the positive and the negative that exist in every community all over the world, but we simply don't know enough. And I think a community radio station can totally support our exchanges and differentiate our potentiality to know. The fact that the community I work with decided to start with an analog radio, it was because of the cost. People will not be able to afford to listen to the radio on using their data. So the analog radio is the answer. At the same time, it's true that having a hybrid solution, like the hybrid cars, a hybrid solution of digital and analog allows them to reach out for other people because they realize they can network with other bigger radios, other organizations. I remember a few times they were inviting also people from the city of Cape Town to talk about specific things that they wanted to discuss on the radio, but at the same time they were recording the interview and putting it on the, having it as a streaming on the digital side and expanding their opportunities. And what I was saying about the fact of knowing more is, for example, what we saw during the pandemic, and was one of the slides I was showing about what happened during COVID and the fact that we were finally able to discover so many issues that are going on, but at the same time, knowing that there is so much potentiality that depends on the existing realities, values, cultures, and that can be supported if you want to achieve something. Instead of thinking, we can come with solutions from top down.
Yeah, I guess, I mean, it's difficult to get to know all these different networks and power from the community without being there, right, immersed. So there is something that I remember for your presentation that really got me. So it's like, we know that technology can support communities, right? But it's not always the solution. So, and then you have this in the slide, something about considering the risks of introducing something that is novel to the communities. So from the experience that you have with the communities, how do you feel about introducing other sort of technologies? What sort of challenges we need to, as designers, we need to pass in order to reach the communities if we want to design something?
I can make an example from a different community that is maybe more connected with the theme of maternal health. I work a lot with groups of women. And when I started working with the groups of women that are doing support groups, and then during pandemic, we created WhatsApp groups so that they can keep on exchanging and keep in contact and help each other. And in case of need, reach out for organizations that can help in the extreme cases where there is a case of violence. When I started working with them on the digital side, on trying to use alternative solution that is not only the fact of coming together and work physically together. At the beginning, I thought it was not going to work, honestly, because none of the mamas I was working with was using a smartphone or any other digital solution that I could think about. But eventually, while we were we created a digital storytelling also with them. And they selected pictures and they were trying to show what they wanted to share with other people, what they wanted to tell about their own community and reality. But at a certain point, while we were selecting pictures and images, they were telling me, wait, we want to learn what you are doing, how you are editing a video, how you're putting information together, how we can do that and share. And the other thing was quite relevant. How can we prevent our kids to face problems when they are on the social media? That was something that was unexpected, but they were like, okay, you ask us if we use Facebook, and no, we don't use Facebook, but we know what it is. And we know that there are risks associated to the privacy and the potential risk that our kids, above all our daughters, are facing. So they were like, we want to know, we want to learn. So they were the one asking me, abandon the digital storytelling, let's do something else. Let's do training and workshop. Let's move a step further.
Yeah, okay.
And I simply follow the flow.
Yeah, I guess with the community. Beth, there was a question from Alessandra. I don't know, you want to elaborate a little bit more about your reply, about the responses, whether or not participants got any response to the messages?
So thanks, Alessandra, for asking those. So Alessandra has asked in the chat, you know, what happens when, you know, when these people asked questions, and there was many more, you know, did I answer them or was there referral? And I explained that I could do a limited amount in terms of referring mostly to SADAG, which is the South African Depression and Anxiety Group, which has a lot of free resources and low data resources on their website and toll-free lines as well. But it is something that can be improved because there was certainly a spike in the messaging or engagement with the page around the three issues of the series on gender-based violence, suicide, and postpartum depression. So, and also just kind of some issues around, well, how am I to live my best life if I don't have a job, you know, that kind of thing. So that kind of referral does need to improve because I don't know how to answer all the questions. So it was a learning and something that we'll carry forward.
Yeah, thank you, Beth. Astrid, there was a question from Kira. There was a question from Kira where she's asking that she's interested to know how or whether to follow up the conversations. Was
yes.
Yeah.
Yes, so we did, I wasn't quite sure if I understood the question. Was that how was that our interviews? Do you mean the interviews with the taxi drivers? Because I didn't go into all the details, but after sharing the products, we had a before and after survey, and then we also had individual interviews with the taxi drivers to get feedback about how the taxi environment changed from their perspective during when the CDs were being played. And they said they found there was a lot of engagement and conversation around HIV and local health services, and which at the time, particularly at that time, was a very stigmatized topic. It still is, but a lot of secrecy and shame around HIV. So to have people talking about it amongst themselves, just and at the same time having that scientifically accurate information in the narrative, I think that was helpful. But it was a small scale project, and one that would have needed further participatory development. I think it's really nice to have people involved in the creation of the content. The narratives were designed by the people from the community, but who work at the research centre. So it would have been nice to have more participatory involvement. And I don't know, there was another question further along from Melissa about the relevance of local culture and locally produced content regionally, nationally, and on a broader scale. And I think that it really depends on the content development and what you want to feature, because in some cases you might cover issues that are very context specific, while there are broader health issues that affect us all. And yes, and you might find that involving local musicians and making it sort of very context-specific targeted messages with local musicians and artists might make it more accessible to people locally, but could alienate people on a wider scale. People might find it a bit strange. That, I don't know, I mean, if you look at pandemics like COVID and some of the overlying issues that affect us all, I think that there is a way to transgress some of those local specificities.
Yeah.
Thank you.
Yeah, I guess part of my question is like, I guess this idea that we want local content creation because we see that local is not well represented on the internet, on the web, right?
Yes.
And not that everything local is going to be relevant to the global, but have you seen bits and pieces that are, and how does that play out? And that question was directed both at Maria Rosa and yourself. So love to hear Maria's thoughts on it too.
Yeah, Maria, you can. I have to. You go first, Maria. I just need to plug my laptop in, so I have to take the video off. So let Maria have a go. Thank you.
Yeah, I think what I was replying in the chat is yes. For me, what is local can be totally relevant because the risk is to losing a lot of elements that are really strictly connected to the culture, and is the deeper inside of our cultures are the values of a community. And the fact that we try to be global and we try to, I don't know what we're trying to do, but we're really risking to lose our background. It's like I spent 20 years in Africa in different communities, and I can claim I've learned something. At the same time, I also know who I am deep inside, which are my deeper values, what I've learned as growing up, and which are my roots. So the fact that I keep on studying the literature for my, I don't know, from my ancestors, and I study still Italian literature, even if it's 1,000 years ago, is still part of who I am and how I can grow up. And the same is for every culture. And it's really risky that the risk of losing all of it exists in modernity. And this is one of the side effects and potential side effects of globalization. So yeah, I'm a big supporter of whatever can be that can remind us of who we are, where are we rooted, which are our values, and what can we do.
Can I say something?
Quite personal as well.
So, so I've just switched off the video. I was having trouble with it, but I think that it's important to challenge cultural hegemony and like the whole global culture. But I also think that, and to honor local culture, but I think one also has to be careful because some local cultural traditions can be harmful. And that it's also important to question those and not to accept them uncritically. A lot of the work that I do these days is with young women around gender-based violence. That's been our focus for about the last 7 years or so. And there are many local patriarchal traditions, such as early enforced marriage and girls stay home, don't go to school, and all these kind of things where girls are losing their voice and girls doing a lot of chores while young boy children have more freedom to do their homework. Yes, I just think that it's also not to accept these things uncritically. So while it's important to bring a local cultural, not really flavor, but to integrate, to make things acceptable and accessible, but also not to accept them uncritically and to get people themselves to speak back to cultural traditions that don't work for them. Anyway, so that's...
No, sure, but I'm just saying that I'm in favor of having a possibility to discuss about them. Doesn't mean that everything is good, that all the local culture or tradition
yes.
and of knowledge are fine. I'm just saying that really, if we don't even talk about that, we have another problem. Is like the taboo.
Yes.
During the pandemic, I started working in South Africa, working on projects on gender-based violence. We opened a shelter for women and children victims of violence in Philippi. It was the first shelter open in that area. And then we started a project with Caravan transforming mobile clinics to talk about HIV/AIDS, what you were talking about actually.
Yes.
And the stigma. And it was 2008. 2008 to talk about HIV/AIDS was even more difficult than now. And when the project started, even before was even, we were considered we were accused of doing something like the new colonizers coming with these new projects. That was beginning of 2000. Things have changed so much, and we have to be aware of also of the changes and the evolution. But if you don't open the issue, you don't talk about it.
Yeah, no, we have to talk. And sometimes one needs to leverage local culture and local leaders to engender change. One can't just go and expect the participants to carry it on their own. So I know when we go to our a lot of the traditional meetings, we all wear skirts, or the girls wear skirts, because we wouldn't be allowed in otherwise. So that's things like that we have to wear dress or skirt, and I mostly just serve tea, because so we just have to go with what works and look at what the greater objective is. But yeah, but also not to be afraid to challenge things when one needs to.
So speaking of challenging things, I think when we think about reaching youth, often like we think, okay, well, now it's just stuck. We have to do social media. But I see also all three of your projects as having been really engaging of the youth in those communities, producing stuff that is relevant. And so I'm wondering, like, what are your thoughts about youth and whether like it should be mobile based versus, you know, digital radio versus serial programs versus TV? Like what are the right kind of technological approaches, right, like people-centered approaches to reach youth? They're youth that are pregnant and having kids, or you know, any other issues that are being encountered by our community-based youth.
I think that, Melissa, I think what you're asking, and it could be, maybe I just need a bit of clarity, but, you know, we, in order to reach, what we realized was the best way to reach people was just by asking our group of, you know, our research group, our focus group, just to say, what do they listen to? I think that's what you're asking. Could be wrong.
I'm not sure if my sound is working, but yes, sure. I think, yeah, what's the best way to reach the people that you're working with? Is it mobile apps? Is it radio?
I think each has got their, you know, their benefits. And I would say that two certainly needs to work together. So for the radio serial, for instance, you know, we needed to have extra information. They often got a psychologist to come on afterwards to talk to people. And we also had information on the Facebook page. So it kind of had to be an extension of information.
My experience has always been to have every option available open, in the sense that when I started working in the community, my focus was on women, not on youth. And the youth came to us and they were like, we want to do hip hop and art. And I was like, I know nothing about hip hop and art and theater. And they were like, come on, you work on gender-based violence. We can sing about it. We can create awareness. We can do sketches. And they were like, let's organize together the 9th of August, Women's Day. Let's have an event and let's do edutainment. And I was like, yeah, sure, why not? So my experience is let's keep the possibility open. And then the moment they decided to create a video and they wanted to have some connections, connect with radio in the city or connecting with, for example, Philippi TV when it started, then you can be I can become the editor of the video. I can become the manager. I know somebody at the Red Bull Studios. I think we should be we can be some, I don't know, creating some networks, supporting where we can, depending on what they think they want, what they need, and be really flexible. That is my perception, flexibility always, and giving a lot of time, giving time.
Great. Can I ask one more question, or are we out of time, Nerva? I'm going to ask questions while he doesn't, while he cannot mute. So
we have the time already, but yeah, you can ask more questions as long as Beth is not cutting off everything.
Beth is muted and she's talking at the screen. So
sorry, I'm saying we're 5 minutes over, so just can wrap it up. That would be fabulous.
Okay. Great. Yeah. I mean, I think my question was for Astrid, but I think I'll ask her offline. But I'm curious, like, whether people had access or people were able to like watch videos on YouTube, and whether like data constraints or data costs were a barrier. But we don't have time, so you guys are all going to think about that question, and we'll have another chat about it maybe at our next webinar. Thank you so much to our speakers for joining us and for such interesting presentations and your perspectives. I really enjoyed hearing all of your talks. I encourage everyone in the CoMaCH network to get in touch with the individual speakers and to ask them for more information or just to chat more about what work they're doing and to read their papers. And I hope to see you all again at our next webinar, which will take place in 3 weeks time, I think, but we will send out an announcement as soon as we have all those details. Our webinars take place on the 3rd Wednesday of every month, generally, except for this this past month, which conflicted with a holiday, and we are happy to continue our conversations around digital maternal and child health. Thank you so much to Nervo for hosting all the questions and to the panelists for sharing.
Yeah,
thank you.
Thanks for organizing.
If someone wants to suggest a topic, just send an email to Melissa and me, and we will try to organize a webinar around that topic. Thank you, everybody.
Bye. Thank you.
Bye. Thanks.